So I get this question all the time. How is it like to be a nurse practitioner working in women's health? I know we talked about, what nurse practitioner can do in general, like diagnose, treat, prescribe medicine, and so on. But a lot of people ask, but what exactly do you do? In this video or episode, we're gonna talk all about that. Let's dive in. Okay, so today's topic is how it is like for a nurse practitioner to work in women's health. So I'm gonna answer some questions that I commonly get, so you have a little bit more idea of what exactly I do as a nurse practitioner. So cases that I usually often see, I see wide variety of cases. I think it depends on where nurse practitioners work. If some nurse practitioners in women's health do only non-pregnant cases, just the GYN cases, and then some places do very limited. They may not do certain procedures. I think we do probably way more than other places. At my current job, I work at a community health center in a rural area, so patients don't have too many options. Like, they can't really go see other places, so we kind of have to handle things, which is great. I love that because I can keep my skills, and I have a lot of skills working there. Anyway, so the cases I commonly see include menstrual problem, like prolonged bleeding, or periods, or heavy periods, painful periods, irregular periods, or no periods. I diagnose polycystic ovarian syndrome, or PCOS, often. Also common GYN problems like yeast infection or candidiasis. Also bacterial vaginosis or BV, or breast problem like mastitis. We do a lot of contraception as well, and I'm going to discuss later on too, but not only the birth control pills, but we also provide like intrauterine device, or IUD, and implants. Also, I deal with a lot of STI, or sexually transmitted infections, including, of course, chlamydia, gonorrhea, but also syphilis. I provide pre-exposure treatment for HIV, and also postmenopausal problems like atrophic vaginitis or hot flashes. Also, we do all kinds of pregnant problems too. A lot of my patients have high risk pregnancies like preeclampsia, gestational hypertension, gestational diabetes, drug use, smoking, advanced maternal age, multiple gestations, morbid obesity, and they also have a lot of socioeconomic problems too. So usually I often deal with high risk or super high risk pregnancy cases. And if it's high risk, or when it comes to pregnancies, because I can't deliver babies, so usually we work in collaboration with physicians, and also deal with a lot of miscarriages, abnormal pregnancies like ectopic pregnancy or molar pregnancies, and I provide preconception counseling. I don't do much of infertility treatment because I'm not trained for that, and I usually refer patients to specialists for that, but do some basic stuff. Also, primary care, because a lot of our patients have Medicaid, or in Hawaii we call Quest insurance, they have such a hard time finding primary care providers. So most of the time we naturally become primary care providers for them, and I do like simple primary care issues like ear infections, skin abscess, simple high blood pressure or hypertension, COVID, flu, all those cases. What kind of procedures do I do as a nurse practitioner? I do pap smear, of course, but also endometrial biopsies, IUD removal and insertion, Nexplanon removal and insertion. Nexplanon is the implant for birth control implant, put it in the arm. IND or incision and drainage, bedside ultrasound for first trimester ultrasound, first trimester pregnancies. So I do a lot of procedures. And usually, so how many patients do I see? Typically depends on, at my current job, typically 18 to 20 patients a day, sometimes more, sometimes less, which is less than what the number of patients that I saw at a private practice in the past. But at my current job, my patients have a lot of problems. So cases that I see is usually very, very complex compared to cases that I saw at private practice. Because the private practice targeted more like middle to high income patients, and they didn't have, a lot of patients didn't have any social economic problems. Meanwhile, the current practice, our target populations are mostly low income or immigrants or uninsured. So there are a lot of socioeconomic problems along with the medical problems that they face. So each case is more complex. So number of patients that we see doesn't really justify, the complexity of working environment. Hey, before we're gonna get into today's topic, I just want to mention that we are giving out free online lesson. It's about time management. We all are very busy every day, but we want to make sure that we have time to take care of ourselves, because when we are too stressed out, then we can't really take care of other people, patients, or even our loved ones. So it's very important to take care of ourselves, but I think the problem is we don't have time. But in this lesson, I'm going to talk about 7 secrets to make time for things you love so you can rejuvenate and be a better person, better nurse practitioner, better healthcare professional. How to access this online lesson is you can go to usa.jnpproject.com/free lesson. Again, usa.jnpproject.com/free lesson, and you can get access to this free lesson. All right, let's get back to today's topic. Anyway, and some may wonder, like, okay, do you have your own panel? Like, do you have your own patients, or do you see patients of the physicians that you work with? At my current job, I have my own panel of patients, because OB/GYN physicians usually come to the clinic twice a week, but me and my colleague nurse practitioner are at the clinic 4 times a day. So we're the main ones, and usually patients see us first, and then we do testing and stuff like that, diagnose, then refer some of the patients to physicians if they need surgeries, or if they are those cases are complex. So we do have our own panel at my current job. Things I love about working in women's health, there are multiple, but some of the things that I want to mention is, first of all, I really, really enjoy empowering women. I experienced painful periods, heavy periods firsthand when I was a teenager, and I felt embarrassed at the time. I didn't really have anybody to talk about, because especially in Japan, culturally, traditionally we didn't discuss much about that, so I didn't feel comfortable. I didn't thought that it's something that I have to see physicians or healthcare providers and I didn't thought that there's something that they can do. But now, as a healthcare provider, I can help them to improve the health condition so they can have more comfortable lives. Like I have a patient that she's a teenager. She always skipped school when she was on her periods because it was so painful, and I can relate that because there was a time that I was literally crying nonstop in classroom because I was so much in pain from periods. And I went to health room, and a nurse told me like, you're faking. And my feeling was so hurt, and I can feel for her that is how struggling it is, to deal with the painful periods. But now with knowledge and skills that I have, I can help her. And she started some treatments, and now she never skipped school for painful periods, and her life drastically changed. And I just love empowering women. As a woman, I want to support other women, and it's so wonderful to be able to do that. Also, another thing I love about working in women's health is we have a close relationship with patients. Especially, I think half of the cases that I deal with every day is pregnancy cases. And during pregnancy, patients see us quite often regularly. It could be every 4 weeks, or it could be every 1 week. Depends on where they are in their pregnancy, and also how complex, how risk their pregnancy is. But we see them quite often during their pregnancies, and during that time, we I think we built some trust relationship, and it's so wonderful to be able to help them. But also, it's such a rewarding to see their children coming back later, and then see them grow up. And I know those kids before they are born, and it's such a wonderful experience to be able to be part of that person's journey and the family's journey. So I love about that. It's so special to work in women's health. Also, we have amazing collaborative relationship with physicians. Some physician groups are not as friendly compared to OBGYNs, but ACOG, or American College of Obstetricians and Gynecologists, publicly said they support nurse practitioners and midwives. And all the OBGYNs that I worked with before are very supportive of nurse practitioners, and it's such a great work environment for nurse practitioners. And lastly, I love about women's health because it's a specialty, so it's not as wide as, like, let's say family practice, that you kind of have to know everything. You kind of limit to women's health, but at the same time, you still have a wide range of problems that you deal with, or cases that you see. And also, and so it's never boring. I learn new things often, and still, even after working as a nurse practitioner for 10 years, I still have a lot of things I learn, and I love about that. So that's all for today's episode. I talked about how it is like to be a nurse practitioner in women's health. Let me know if you have any questions or comments. I read all the comments, so I will appreciate if you leave some, even like say, hey, I'm thinking of becoming a nurse practitioner in women's health. Any comments are welcome. Anyway, I hope you have a great week. Have a wonderful day as well. Aloha.